If you need care in a hospital, but you pick the wrong one, it might be more dangerous than base jumping, riding a motorcycle on the freeway with no helmet, or even taking a selfie from a place like this. You don't believe me? A study in 2016 found that Americans in some hospitals are 3 times more likely to die than those in other hospitals. They're also 13 times more likely to see serious complications. Imagine that. What that means is that if you or someone you love, let's say your grandma, needs to go to the hospital for extended care, they will be more safe riding on the back of your motorcycle with no helmet than they might be if they're in the wrong hospital for an extended care at that hospital. You don't do things like that to your grandma. This is personal for me. My grandma died 5 years ago, and our family felt that part of her early death was that she was in a hospital that didn't take good care of her. I still wonder if she'd be around today if we had been at a different location. Now, the challenge is, how do you know which hospital is a good one? Here are 2 ways that you really can't know, but it seems like you should. The first is asking people who've been at that hospital. Sure, they'll tell you if the toilets were clean or the bedside manner was good, and those are helpful perspectives. But in terms of really knowing whether the care was high quality, we as patients just really don't know that. Let me give you an example. Many surgeries today can be done laparoscopically, meaning that you only need little tiny incisions instead of a really long one in order to do what needs to be done. But for many types of laparoscopic surgery, hospitals and physicians that complete those surgeries may not be adopting the newest techniques, meaning that your recovery is weeks instead of days, and extra painful and possibly extra dangerous as you could get infected. As a patient, you don't know whether your surgery really is an option for laparoscopic surgery. You may receive an answer that it's not, but really the real reason is that the hospital and the doctor are not ready to give you the cutting edge care that you really deserve. So asking patients has limitations. Another option that has significant limitations is looking at the statistics for different hospitals. I'm actually a statistician. The challenge that we have is that the sickest patients go to the most complex hospitals. And so a lot of patients at those complex hospitals end up dying, and it's really hard to know, is that hospital not delivering good care? Or did they just have a lot of patients that were really sick go to their hospital compared to other hospitals? So doing those comparisons based on the data is really difficult. However, there is a way to know which hospitals are good. I've been in healthcare for over 15 years, and I know something that almost everybody in healthcare does, which is that you don't go to a facility, a hospital, or a doctor unless you've gotten a reference from a colleague who's worked there or worked with that person. This is a nearly surefire way to get a great perspective as to where you can get really high quality care. But there's over 300 million people in America, and most of us don't have those connections. This is the reason why I've quit my day job and joined forces with Dr. John Lee, an emergency medicine physician. And we're trying to change this. We founded the Healthcare Lighthouse. The Healthcare Lighthouse is a research organization that is collecting the voices of caregivers about the facilities that they work in. Specifically, we're going to nurses. Nurses see everything that goes on in a hospital. They see which physicians are safe and which physicians, frankly, are dangerous. They see if the hospital administration truly cares about safety, or if they're just caring most about covering up mistakes. The challenge is that nurses can't speak out without risk of losing their jobs. So the Healthcare Lighthouse has been found to create a safe place where nurses can speak out about the organizations that they're working at and the physicians that they're working with. We are sending out this survey and conducting it over the phone to tens of thousands of nurses across the country. But we can't do this without your help. We need you to send out this link, www.healthlighthouse.org/participate. Please send that to every nurse that you know. And please send along this video to everyone that you know so that they can send it to other nurses. This is going to be a monumental undertaking in order for us to start to really understand the quality of care being delivered at different organizations. But it's going to make a huge difference in America. Please also subscribe to our channel. This is going to be really exciting. Hospitals and healthcare are big business in America. And there are some who don't want to see this type of transparency as we publish these ratings for the world. Come along with us. We'll be updating weekly as we take these steps to investigate and to understand where great healthcare is being delivered. We'll be getting to your hometown soon. So please join us. Send out this video to everybody that you know. It's time for a healthcare revolution. It's time for educated consumers of healthcare. It's time for us to know the quality of what we're receiving. Thank you so much for joining us in the healthcare revolution.